Greetings, everyone. Greetings from Sweden. My name is Fredrik Lindberg. I hope you all can hear me well and see me as well. Summer is struggling, but it's still almost here. But it's fading away. It's 20 degrees today. Cold weather is coming in. I am in Gothenburg in Sweden at the Department of Earth Sciences. I'm a lecturer here in geography. And I have been asked to moderate this key session on heat health in the built environment. Thank you very much for that. As you know, heat and health in cities has been coming more and more interesting and alarming subject for many of us, and also for the population as a whole all over the globe. And I think our community has a good value and can contribute a good deal with our knowledge and expertise in this area. I also see this as a good thing, well, having this as a keynote session, that we can have two nice presentations on this subject in quite different topics, and then we can have a discussion afterwards. For those of you who didn't join the first plenary session, if you look to your, I guess it's right, yes, we have different types of chats and questions and answers. So we ask you please to, when you want to ask a question for the related to the talks, you ask them in the question and answering section, and then you can also vote for questions, and then after the presentations, we will go on and have a discussion with the speakers on your questions. You should also be remembered that this is recorded, so you have that information also. And as I said, we had two speakers, and we will. There are two ones, so the Dr. Clare Heaviside, and it's Jason Lee. Clare, I hope I pronounced your surname correctly. I have been asking around actually at my department, because I never seen this surname before, and I got tons of different answers actually from my colleagues. So I hope I pronounced it correctly. Clare will talk about climate change and health, heat and mortality in urban settings. Clare is from the UK. She's currently at University College London as an NERC independent research fellow. And her research interest is mostly multidisciplinary, to cover climate change, health impacts, air pollution, and urban climates, and so on. So, Clare, I think without further ado, please take the floor.
Hello, thank you, Fredrik, for that. I had a bit of trouble sharing my presentation a minute ago, so I hope this will work now. Or maybe I do this. Does that work? If someone can see my slides, or you can't see my slides?
It looks okay. I can see it.
Good, excellent. Thank you then. Great. Yeah, so I'm Clare Heaviside, but Heaviside is fine. I don't mind either way. So thanks very much for asking me to give this talk. It's very nice to talk to everyone. I'm in France currently. It's quite warm here, much warmer than 20 degrees, I'd say. So today I'm going to talk about climate change and health, but more specifically about heat and mortality, and with a particular focus on urban settings. So I'm going to talk first of all about the European heatwave in 2003, and it seems a very long time ago now, and obviously we've had many severe heat waves since this time, but this was a kind of special heat wave in that it was one of the most well-studied heat waves, and it was launched a lot of research, but also some response as well in the form of heat health warning plans. And you can see from this satellite image that France was particularly badly affected by the heat wave. And to give you an idea of the mortality that occurred at that time, this graph here shows the daily mortality data in France. So you can see all of these grey lines going from 2000 to 2019. So it varies on a daily basis. And then the red line is the peak that we saw in 2020, and that was due to COVID, where we had a sudden increase in mortality. But if you look in the background, you can see this really big spike in mortality that happened in 2003, and that's attributed to the heat wave. And you can see that the numbers of deaths were reaching over 3,500 a day. So that was a really severe impact. And it's thought that this heat wave was associated with up to 70,000 deaths across Europe. So clearly we know that heat and cold affect mortality, but heat waves are something that we are seeing a lot more frequently, as I'm sure that you're all aware. So we know that there's a relationship between temperature and mortality, and you can model this in lots of different ways. But in general, you see that there's an increased risk of mortality when you go above a heat threshold, and again, increased risk of mortality when you go below a cold threshold. So for any given population, if you have enough data, you need decades, ideally, of daily mortality and temperature data, as well as confounding factors, data on that kind of thing, air pollution, flu events, and so on. And you have a temperature distribution, and that's related to your mortality risk. And as we see temperatures increase because of climate change, you might expect at a first approximation that we're going to see more heat mortality in future, but you might think we're likely to see less cold mortality in the future, given that the temperatures are rising. So in some ways, this is approximately correct, but there are lots of complicating factors that mean that it isn't as straightforward as this. So one of the main things is that changes in baseline mortality and underlying health conditions strongly depend on demographic changes. So it's not simply the exposure to heat and cold which is important here, because if your demographics are changing at the same time, then this has an impact on how much heat and cold mortality that you see. And another effect is that heat effects tend to be underestimated, because when you use climate projections, say you're using quite a coarse climate model, we're not seeing the urban heat island effect, which we know makes temperatures higher in cities, and that's where people tend to be living. So the overall kind of message here is that estimates of future temperature-related health burdens are likely to be underestimated. And I'll give you an example here. So this is for the UK. This is some work we did a number of years ago. And what you can see from the graphs is on the left, you have the change in expected heat deaths from the 2000s out to the 2080s. And on the right, the change in cold deaths from the same period. And first thing you can see is that heat deaths are much smaller than cold deaths currently. So we have about 40,000 cold deaths a year in the UK and about 2,000 heat deaths. But you can clearly see this sharp increase expected in heat deaths, and you don't see such a fall in the cold deaths. And that's mainly because we, in this work, we included population projections in future. And what happens in the UK is the population gets larger and more elderly in future, so you don't see such a benefit from the reduction in cold weather. So this is based on the UK climate projections from 2009, and they are run at 25-kilometre resolution. So that's quite high resolution really for climate models, because these are specifically just for the UK. However, as I'll show you in a minute, they're not capturing everything. So I think everyone here is well aware of the urban heat island. You've got colder temperatures in parks and higher in the built-up areas. This effect can reach a maximum during hot weather, meaning that it can be extremely dangerous in cities when we have heat waves. And we're interested in urban populations because over half of the world lives in urban areas. In the UK, it's about 82%. It's a very urbanised country. In many parts of the world, populations are growing and ageing, and urban areas are simply expanding in lots of countries. So, as I mentioned, climate models are generally run at slightly too coarse a resolution to capture urban heat island effects. So, if you look at the bottom right, this is the 25-kilometre resolution, so you can't really see the effects of cities. But if we look at more like 1 kilometre resolution, you can see this is London. You can pick out the parks, which are the cooler spots here. And traditionally, again, I'm sure you're all aware, we have a lack of observations in urban areas. So we don't know as much about our weather in cities as we would like. And this is what, basically, this is what I'm interested in, and this is what we research at UCL in my group. So we want to address a number of research gaps. So lack of urban observations. So one way around this is that we've started looking at citizen weather stations as well as official stations. The global models don't resolve cities, so we're running meteorological models at 1 kilometre resolution. We know that health impacts are highly sensitive to demographics and socioeconomic status, so we're including more demographic parameters in our health impact assessments. And we also want to look at how we can reduce health impacts from overheating in cities, so we are modelling interventions and carrying out health impact assessments. So I'll give you a quick example how we use mesoscale modelling. So this is some work that we did a little while back. We're using the WRF model at 1 kilometre. Basically, for this simulation, we're using 3 urban classes. We're using the BEP urban physics scheme here, so you've basically got lots of 3D features, you've got vertical distribution of heat, and it means that we can manipulate different urban factors to see what the impacts are on the local climate. And the study area is Birmingham in the West Midlands, so that's the second biggest city in the UK. And as you can see, there are 3 urban classes from industrial and then high residential and high intensity and low intensity residential. So from this, we modelled the West Midlands, and we found that the urban heat island intensity was around 7 to 10 degrees over the periods we were looking at. And from this, we were able to estimate that the urban heat island is potentially responsible for up to 40 or 50% of heat mortality, which is clearly a significant number. We're interested in interventions to reduce this kind of mortality. So within the model, as I mentioned, we can vary some of these parameters. So we varied the roof type, and we changed to cool roofs, which are basically just reflective roof surfaces. And we found that they were quite effective, particularly on commercial buildings, at lowering the maximum daytime temperature. And they can offset some of this urban heat island mortality proportion by up to about a quarter. And we also looked in winter because we thought it's important that any interventions don't have unintended consequences. And we found that the urban heat island in winter is actually quite protective for health, so it can offset about 15% of cold deaths. And even if you leave these types of roofs on through the winter, they don't have such a detrimental effect on health as in reducing the heat in the city, because you get such less solar heating in winter, which is potentially good news in terms of interventions. So we also did some spatial analysis, and we found that risk factors tend to be co-located. So where obviously you have your highest temperature and population density, but you also see the highest levels of deprivation. And you can see if you plot deprivation against urban heat island intensity, you get this kind of relationship. we found that housing types which tend to be prone to overheating, like apartment buildings, are located in the warm parts of the city as well. And I'm just going to briefly introduce some more recent work now. So that work was based on 3 urban categories, but as I'm sure you're all aware, there are many more types of urban landscapes. So we started using the local climate zone classification. So now we've got up to 10 urban classes, and we're looking at different cities. So here's an example for London, and this is work that Oscar Bruce is carrying out for us in a project funded by Wellcome. And basically, you can see the colours. This is London. The different colours represent the different local climate zones, and the dots, the black dots, represent the citizen weather stations. So Oscar's been looking at how to use these stations and quality control them to make good use of them. Modelling across London, the kind of the urban heat island intensity, and again, the impacts of things like cool roofs and green roofs as well. And the intention is to link these with health impacts and economics as well. And another piece of work which I'll just cover briefly. So this is led by Charles Simpson, who's also working on the Wellcome project. It's called HEROIC. It stands for Health and Economic Impacts of Reducing Overheating in Cities. And Charles has been looking at green roofs in London because we realised there's actually no up-to-date public database of green roofs. So he's been looking at using machine learning and lots of different spatial analysis to find out where the green roofs currently are, what type of buildings they are on, so therefore what buildings are suitable for green roofs. We're interested in whether they make a difference to urban temperatures, both indoor and outdoor, and potentially how many more buildings could have them. And for example, he's modelled over the whole of London and sort of classified the density of the green roof areas. And I'll just summarise now to give time for Jason Lee. So basically, as I'm sure you're aware, urban populations are likely to be at high risk of overheating due to the urban heat island effect and also climate change. High resolution climate modelling and use of demographic and environmental data sets can improve our health risk assessments. We can model the health impacts of urban adaptation measures, and we need to employ adaptation measures practically, because although we need to focus on mitigation to meet net zero targets, it's clearly important that we also have adaptation, because we are still seeing certain levels of climate change and that will continue into the future. But it's possible that we can achieve both health and economic benefits from policies aimed at mitigating climate change. And if you think about things like changing our transport systems, we can reduce the greenhouse gases from reducing car use. That's obviously good for net zero targets. We can encourage greener transport, which reduces air pollution. We can encourage healthy, active travel, which is clearly better for health as well. So all of and economic benefits. So greener cities are economically more prosperous. So this is the kind of the direction that we want to be going. And I'll say thank you for listening, and that's all I have. And I'm happy to take questions.
Thank you very much, Claire. I think we do like this, that we introduce Jason first, and then we take a discussion or questions afterwards. So we can have a nice discussion afterwards. So the next speaker is Professor Jason Lee. He's in the University of Singapore. His research interests are extreme physiology, heat on occupational health, performance and safety, and so on. So going down maybe to the scale of the human being here. And he's going to have a talk on heat on health, on human potential, problems and solutions. So Jason, please.
Thank you, Fred. Can you see my slides?
Yes.
Fredrik? Perfect. Thanks again for the introduction. I also want to thank the chairs for the conference here, Melissa, and again, I actually had the reward before this presentation. They gave me a good sumptuous meal and ice cream in back in Sydney before the flood came in Australia. So thanks so much for that. I got my reward before my talk. Thanks, Claire, for setting the scene well. If you may, I want to, if you allow, I want to focus on the workers. As we talk about the urban environment, let's not forget that it is the workers, migrant or not, working hard so that we can live in comfort. Yeah, we are talking about work. They are out there risking their lives. So I want to focus my talk on this particular sector, for they are the foundations of our economy and contribute significantly. So in my very short presentation, because I was told not to go too long, it's just to provide an overview on how heat can impact across the societies. Then I will quickly talk about physiological solutions, since I'm a physiologist. That's the only thing I know. And then I will end my talk by calling for collaborations, and then we can have a chat together with Claire. So that's the plan. I think we've seen enough of such news appearing daily, right, in the form all over the world. I hope we are not numbed. That's the most concerning part. So bad news that is repeatedly placed in front of us, we might forget and ignore it. The fact is, climate scientists have long warned about these conditions, but the future has arrived much faster than we thought, than we hoped. So let's take actions ASAP. Okay, I would like to start with these slides. So I ask that you imagine with me, you are this trapezist walking on this tightrope in a circus. I'm the trainer, and your task is to realize your true potential. You have been training hard for these days. So my question is, with or without this safety net or safety hand below you, would you seek to maximize your potential, your performance, your true self? So food for thought. You can close your eyes if you want to. So my question is, would you seek to push your limits and therefore realize your potential, maximizing your work productivity with or without that safety net? The truth is, with that safety nets, by understanding safety limits, one can push and realize his or her true potential. It's often that we do not know the limits of that population, which is made up of several individuals. Either we become too aggressive and push a few over the threshold, or we pay the price of work productivity when we prematurely pull them out. So my message here is safety and performance are not at the different ends of the spectrum. We can achieve both in tandem. So what is this all about? The message here is to achieve optimal work productivity in the heat. We ought to ascertain human limits. We ought to understand the limits, and every human is different. I think personalization is the way to go. We may not be able to personalize work, but we can stratify them in groups based on personalized profiles. So optimal safety for optimum performance. I've shown this slide a few times for those, because I see familiar names in the audience, so great to see everyone. But I want to be more optimistic. Too hot, no problem, because you have other determinants or factors that affect heat strains that you can regulate. So heat stress and heat strain are not the same. I think if we go about providing advisory solely based on climate, I think that will not bring us very far. Note you have other factors to alter if it gets too hot. My fear is it doesn't mean that the hotter it gets, the worse it becomes. And therefore, we might pay less attention in milder condition and assume that it is safe, and it is not. Because if it is milder condition, one is done with layers of clothing, he or she chooses to work very hard. in that condition is much more dangerous than a very hot condition where one wears little and not exercising. So let's not simplify things. Humans have behaviors, and it's not just solely based on climatic heat stress. We have the choice not to work at times, but as the world gets warmer, there are many individuals, workers, soldiers, firefighters, law enforcers, etc., healthcare workers have to work in such condition. Usually the three bubbles or outcomes we are most concerned are about heat injury, heat stroke, work productivity, but less understood is the bubble on the bottom right, accidents. I'll show you some data and explain what we're going to do prospectively, in particular to tackle accidents. We only understand the acute impact on heat stress. Here we get reports from Central America that sugarcane cutters are performing DIY dialysis at home. This young man passed on in late 30s, early 40s. So we are just at the surface of understanding how heat can affect human health. Traditionally, they have attributed this to the pesticides, to the genes of this population, but smart studies, when they compare supervisors on site, which will immediately eradicate the genes components, the pesticides, and clearly show it was the workers who paid the price and not the supervisors. So be careful, if we bother to find things, sometimes we will uncover more things that we don't want to find. Right in the middle of the pandemic, we had to formulate advisory to address the conflicting guidelines pertaining to protection against COVID-19 and for heat management during heat waves. Note as we tackle urban warming, bear in mind there are other societal urban challenges. So we need to provide advisories that do not contradict. So for example, as the population age, there's a set of advisory, and then with heat being compounded in order to make sure that the same advisories do not contradict one or the other. We know these findings well. In a hot environment, you just cannot last as long as compared to the neutral and cool environment as depicted by the 20 degrees Celsius and 3 for the neutral and cold environment. By the hot environment, one will curtail prematurely. So this is fairly common sense. But what we don't appreciate is humans are more sensitive to temperature than we thought. In this slide, we arrange marathon races in ascending orders based on maximum dry bulk temperature. And you could see a corresponding decrease in the number of finishers, even with very small increase in maximum dry bulk temperature. I wish the bar on the left could be higher and it could be a nice story to tell. But again, here reinforced is not that straightforward. When you hit a sweet spot that it is not too hot, but good enough for the runners to over push, and therefore likewise they didn't finish as well. So it's definitely more complex than just climatic heat stress per se. I mentioned about heat on accidents. Here's one study to show that heat can affect our risk perception. And I think if we pursue more in the occupational setting in this particular outcome, I think we're going to do a lot of good for the workers, because usually this is no longer the decision of the employer. There's usually authority that will govern this and therefore protect the health and welfare of our workers. Already in Singapore, the latest stats is 36 lives have been lost this year. We lost 37 lives for the whole of last year. So we are past the midway point, but yet more lives have been lost, month-on-month comparison. So that is not great news. Allow me to quickly introduce Project Heat Safe, because there is one project I want to extend for collaborative efforts prospectively. Here, we look at workers in Southeast Asia by bringing together a multidisciplinary group around the region with in and out of the islands to first understand the impacts on heat strength on workers before providing sustainable policies, with that economic lens too, because there are so many problems in the world. We want to help the chairman in the boardroom to understand which is the bigger problem, and therefore resources can be prioritized accordingly. I will not go into detail of this project, but I ask that you check this out so that we can have collaboration prospectively. But what I want to emphasize is in that project, we are beginning to tap on technology, in this case VR, to understand how the increasing heat stress can affect our decision making. In this case, the VR tasks include a welding task and the plank walking task simulated at 20th floor of an unfinished building. I think we should move from pressing of spacebar, assessing cognitive performance, to something with higher ecological validity. As we know, heat stress will affect across the whole society, and as the population age, we know the two main regulators of heat loss, skin blood flow, and sweat evaporation will be compromised in this elderly, especially with medication. So we ought to pay more attention, especially we expect there will be more older individuals still performing exertional work prospectively. Another way, there's one big problem we can't solve in Singapore and many parts of the world, this perennial issue of insufficient replacement. We know strong epidemiological findings to support that heat degrades fertility and pregnancy outcome. I hope a few of us in this call are aware of the ongoing grant call by Wellcome Trust, looking specifically at the biological vulnerability of heat on maternal and children's health. I think we ought to understand the exact pathway that how heat can affect pregnancy in this case. So the main message here is the protection of our workers against extreme heat goes beyond just work productivity, and workers have a huge societal impact across workplace. Okay, so very quickly, I just want to offer some physiological solutions. A good physiological solution will either reduce your heat strain at the start, attenuate the rise during work, and extend the limit. If somebody comes to you and say this gadget can reduce heat strain, you ought to ask which phase is that gadget affecting. If it cannot be explained, likely it is a gimmick. It's not a tool that can attenuate heat strain. Because by doing so, you realize your y-axis is now expanded. Your thermal capacity has expanded, and that has strong associations or relation to your ability to last in the hot environment. So this is an array of physiological solutions one should harness. So getting fit is no longer just for health. Getting fit is also good for heat proofing. You know about heat acclimatization, consider pre-active decooling, optimize your work rest cycle, and hydrate appropriately. Of course, you can do all these but one with various reasons, motivation. If you are paid by piece, for example, you can still choose to bypass your maximum limit. So bear in mind that exertional heat stroke is also a behavior. There's also a behavioral component that one choose to exceed the extended limits, even you incorporate all the goodness of the various heat mitigation strategies I talk about. So finally, here is one. So now again, myself, a few others have considered this approach of using not just the climatic inputs, but physiological inputs, may it be your wearables on your phone, via predictive analytics. We call it a heat health index here. So that is the future we are envisaging, that with a given climatic heat stress, understanding your own physiology and therefore vulnerability, we can prescribe heat health advisory more accurately. All right, so now finally, the Heat Resilience Performance Center will be set out at NUS. I want to use this opportunity to advertise it and extend collaborative efforts prospectively. So do drop me a note, if you'd like to hear more about this new center. Okay, that's true because I want to leave time for discussion. So thank you for listening. I'd like to thank my team for all their efforts. I'm mainly just communicating their work. Thank you so much.
Thank you very much, Jason. Very interesting, and interesting to see two types of perspectives on this issue. Clare, if you could put on your camera and mic, and then we can have a discussion, the three of us. We have had some questions coming in, some thoughts that I thought we could discuss upon a little bit, and feel free also to ask more questions and also to vote for questions if you think they are interested in the Q&A section. One thing that came up here, I think maybe it's a question or a point of discussion more for Clare. It's about doing this kind of big scale, like national or regional investigations on heat and health, and relating it to the urban heat island, as this is something that is, well, something that traditionally has been quite interesting to look at. But the question is, how does it actually compare to the mortality, or for example other health issues, compared to other things that you can use? I mean, I think the question maybe relates to radiation and wind and such, because I mean the urban heat island is a nocturnal phenomenon, and we also have the daytime issues where we see people also suffering during daytime, especially with high solar radiation and so on. What's your thought on that, Clare?
Yeah, I mean, looking at some of the questions, I think quite a lot of them are related. So maybe if I say something, it might cover some aspects of these questions. So in particular, is the nocturnal urban heat island the best measure to capture heat health issues? And I think that's a very important question, because as the urban heat island is obviously a nighttime phenomenon, we know that. But the difference between, say, the work that we're doing currently and the kind of work that, say, Jason and people are doing, is that we're really focusing on mortality, and that's just one health impact. Obviously, it's a major health impact of heat, but it's one health endpoint, whereas there's all this whole spectrum of productivity, thermal discomfort, and so on. So one thing we do know is that the nocturnal urban heat island, so if you have a number of nights where it doesn't get cold, then people tend to get ill sort of cumulatively. And I've seen some very nice research in Sao Paulo that shows the dose response coefficient, or the exposure response coefficient to heat, gets worse if you have like a 5-day heat wave than you do a 2-day heat wave. So we know that that is a thing. But when we look at mortality, the best predictor for mortality is say a daily mean temperature. So we tend to use daily mean or daily maximum. And the problem with using daily maximum temperature is then you're not capturing your urban heat island, because you're capturing the maximum. If you use daily mean temperature, cities' daily mean will be a lot higher than rural areas. So we have looked at all these different metrics, and we do think that there is definitely an impact of the nocturnal temperatures being high, and that's kind of captured in the use of the 24-hour mean temperature. So I don't know if that answers some aspects of that.
Do you see any potential of using this kind of numerical weather prediction models, of taking in other parameters? I think I'm mostly thinking of radiation. To capture more of the daytime variations, because you get very large or high spatial variations of the radiation during daytime, that's not happening during night.
Yeah, so things like radiant temperature, do you mean as well? Or I mean, all of it's so complex, obviously, in an urban environment. Most people are indoors at night, so this is why we focus a lot on indoor temperatures as well within the department I'm in at UCL. There is going to be lots of difference in exposure around the city. So we try to do as much as we can at saying what types of housing, what types of neighbourhood are people more exposed in or less exposed in, and what kind of demographics are those people. But in terms of things like productivity, and I think Jason, he can talk about this, I'm sure, productivity and thermal comfort, then these parameters are very important. We don't use them so much for mortality, because we just need the air temperature basically. But that, if I was looking at productivity or other things, then I certainly would take that more into account.
Mm. Maybe we can move on a little bit, and maybe also a question to Jason, because when I heard your talk compared to Claire's, I mean, productivity is something that you can put a quite nice economic number related to productivity, and maybe we can communicate this issue a little bit easier if we don't talk about mortality, but instead talk of productivity. But the question is, how should we actually address that, and how can we relate the productivity issues to actually warm weather and heat waves? What do you think on that, Jason?
Yeah, I think it depends who you are talking to. I know different stakeholders have different touch points, that will affect their decision making. And even coming back to productivity, if someone is being paid by piece, right? And if we increase heat, then we know the price we're going to pay is one of health, because he will continue to work hard because he's being paid by piece. But if someone is paid by per hour, then it's a conversation of economics, because now the cost will go to the employer, because this person will likely slow down knowing that he will be paid the same, and there will be no health implication on him, but huge economic implication on the employer. So it's very contextualized, to even different sectors, how they undertake the business. So that's specific to work productivity. But there are a lot of things not quantified yet. In the typical northern atmosphere, the price you pay on heat is usually seasonal. You have heat waves, you pay the price. But in tropical climates, some assume that there is no price because the individuals are acclimatized to the heat, which is not true in Singapore, I can say, because we are so exposed to heat stress. The whole behavior has changed. We are actually not as heat acclimatized as many assume. We hide in air cons, and then there's a whole list, a whole sorts of problem. We don't have opportunity to exercise outdoors, and there's another set of problems. So we need to quantify the implications, and as what Claire said, it's actually quite complex. We want to quantify every impact, but it is not so straightforward. But at least we should be aware it's not just mortality, morbidity, work productivity, accidents, mental health, all sort of issues pertaining to heat stress.
Yeah, and I think you address one interesting subject is the variations that we can see around the globe. I mean, in Sweden, for example, when we have nice warm weather, I mean, I know people take a couple of hours off, maybe go out because we don't have it that much and we want to enjoy it and so on. So that kind of productivity loss is, I mean, it's very difficult to capture at all. So it's quite interesting. One other thing that I mean came up in both of your talks is the elderly, the old people, which of course from Claire's perspective, it seems like it's the elderly that a little bit are also a control measure on the mortality, and because the shift in population demographics can actually cause variations in how many that will actually have issues during heat waves and so on. And we have the same in Sweden, and it's very much now focused on the elderly and so on. And I think one question was related to this, that is it the elderly that we should focus on when we plan our cities? I mean, we as a working population, we can maybe address these issues quite good. When it's warm weather, we can protect ourselves, but the elderly has not that opportunity. So do you have any thoughts? How is the elderly the group to focus on?
Yeah, I mean, they really are the more vulnerable when the sort of risk of mortality is much higher the older you are. And I think one thing about the elderly is that they spend even more time indoors than the general population. Something that the 2003 heatwave really highlighted was usually the older you get, the more likely you are to die. But there's something unusual happened in that heatwave was that slightly younger people, say 60s to 70s, who were living alone because maybe their families were on holiday, they were actually dying more. Usually it's just the older you get, the more likely. And that's because the really elderly were in care homes and they were to some extent looked after. And it's the kind of, I think that there's a real problem with elderly people living alone. That's quite a vulnerable group. So indoor temperatures are going to be quite important. And something that we look at UCL is sort of, we try to look at behaviour indoors, because how you might have a very fancy cooling system, like a mechanical ventilation or some kind of passive system, but people often don't know how to use it. In the UK, most of the elderly will sadly die in the cold weather, and that's a real problem with the energy prices, which we are, really concerned about. We don't tend to have air conditioning at all in the UK in houses. So people in care homes, that's probably a really, that's an area that we do focus on, and we look at design of care homes and how we can protect the elderly, because that's directly the most vulnerable group.
Anything to add on that issue, Jason?
Yeah, I think Claire has said it all. I just want to add that definitely the elderly should be prioritized, but that doesn't mean that other segments of the populations are fully protected. I'm quite worried for the children of our generations, largely more sedentary, and if a child pass on as compared to the elderly, the impact will be quite different. So let's not wait for that unfortunate case to occur. Then we start thinking, hang on, there is a missing gap here. But going back to the elderly, I like to paint a vision of how we treat heat stress for the elderly. Could be one, and how we place AED around the neighborhood. Can cooling facilities be considered in prospective planning? Again, talking about the elderly, sometimes the solutions are there for whatever reasons, right? My grandparents would not use the aircon because they said they're going to pay the bill subsequently. And also they will tolerate the heat because they don't want to pay the bill. But can the government pay the bills in times when they need aircon access? At every block, there is a cooling facility, and therefore they can use it conveniently and not pay the bills. So that's one concept, that can heat relief system be seen like an AED that is everywhere in the neighborhood. When somebody needs it, you can use it.
Yeah, it's a good point. And also, as you say, it's not just elderly, and also, of course, we have other population groups, both like economically challenged and so on, that doesn't have the opportunity to protect themselves in the same way. So of course there are all kinds of groups. I'm just feeling a little bit with the elderly that it's kind of a hot topic at the moment. At least in Sweden, it's a quite hot topic to talk about the elderly when it comes to heat stress and so on. Right, let's see if we can take one more questions from the list. I think I saw $1 million question here. Yes, we can mitigate the urban heat island for the summer, but what do we do with the winter benefits if we create a city that doesn't have an urban heat island? Claire, answer that, and you can get the Nobel Prize.
That's a good question, as Fredrik says. So that's one of the reasons that the work that we're doing with this Welcome project that we're working on is to measure the unintended consequences as well. So what we've found is that for outdoor temperatures, when you have a cool reflective roof, it doesn't really reduce the urban heat island in winter. It does reduce it in summer because there's more sunlight to get reflected. But in the winter, it doesn't have. It reduces slightly the urban heat island, but very small. So that's one aspect which is beneficial, because cool roofs are very cheap. And the other thing is, obviously, we need to focus on the indoor environment. And what we found, it looks like basically if you've got a very well insulated roof and building, putting a cool roof on won't affect the indoor temperature as much as if you had a poorly insulated building. So that sort of motivates. So for winter, obviously in winter you want your building to be warmed up by the sun. So if you put a cool roof on it, you might think, okay, well that's going to be detrimental to my indoor temperature. But if you have good insulation, then your building shouldn't be so affected by that, and actually you can get the benefit. So we really need to be retrofitting poorly insulated buildings. That's kind of the answer, I think.
And I also think working with vegetation in the more micro scale sense of planning, where do you locate your trees? Like well, I go always back to Sweden, of course, but we have a very low sun elevation in the winter time, and use the shadowing from the vegetation in the summer. So if we place it on the right side of the street,
exactly,
and configure that.
So shading of trees, they're very effective at shading in the summer, but if you have a deciduous tree, it lets the sunlight in to through the windows in the winter for sure. Yeah, it's a good example.
Right, I think we are running out of time. Is there anything that you want to add, Jason and Claire, or shall we conclude?
Yeah, I just want to shout out the reference shared by Charles. That's a very good piece of reference pertaining to the healthy living environment, specifically for the elderly. I also recently came across that document by Led Keith and Sarah Miro on the planning for urban heat resilience. A very good report, and it has a lot of good stuff in it. I highly recommend for those who want to consider heat planning in the urban setting. That's an excellent resource to chill.
Maybe you can put the links in the chat for everyone, and then they can access them if they are digital, which I presume that they are.
I don't have the web link, but I'll just put the title here. Just
do that. Great, thanks.
Yep.
Okay, I think we conclude this. Thank you very much, Claire and Jason, for a nice discussion and 2 nice talks. And everyone else, thank you for joining. And good luck, and have a nice conference today and tomorrow.
Thank you.
Bye-bye.
Thanks, Fredrik.
Thank you.
Bye-bye, Jason. Bye-bye, everyone.